Hi everyone, I am Shahan Layek. Welcome back to my channel, and in this video I will be talking about tumor lysis syndrome. So basically what happens in tumor lysis syndrome is the destruction of the tumor cells. So you have a large number of proliferating cells, and destruction of these cells is the tumor lysis syndrome. So what happens when we destroy these cells? Basically, let me discuss about it. So this is your tumor cell which contains the DNA. Now this one is your DNA, and you have a lot of intracellular potassium. You know, potassium is the cation which is more in number, and you have phosphate which is the anion which is great in number. So you have potassium and phosphate, and you have DNA which is actually made up of the purines. So it is just like this structures. So when you destroy this, you get little purines like this. These are the very little purines. So these are the purines. So when you destroy these purines, actually you get hypoxanthine. So you get hypoxanthine, and from hypoxanthine you can produce xanthine. And from xanthine you can produce uric acid. The end product is uric acid. So if we destroy this cell, what are the items we are getting? What are the items? Can you notice what are the items we are getting? One is the potassium. Which we are getting. Another is the phosphate which we are getting. We are getting potassium and phosphate, and after destroying the DNA we are getting the uric acid. So three important things. So from here we can write down the tumor lysis syndrome TLS into three important parts. So we have three important symptoms. One is hyperuricemia. Hyperuricemia. What does it mean? Hyperuricemia means uric acid increased. Hyperuricemia. Next thing which we are getting is hyperphosphatemia. What does it mean? That means increased phosphate levels. Hyperphosphatemia. The last one which we are getting is hyperkalemia. What does kalemia means? Increase potassium levels. So hyperuricemia, increased uric acid level; hyperphosphatemia, increased phosphate level; and hyperkalemia, increased potassium level. So these three things happens in tumor lysis syndrome. So what is the consequence of increasing uric acid? What is the consequence of increasing phosphate? What is the consequence of increasing potassium? Let us discuss about that. So basically, when you have increased uric acid level in your body, then this uric acid will form crystals, and this will be precipitate. This will form precipitate in your kidney, and this will cause acute kidney injury, and this will result in renal failure. So increased uric acid will result in crystal formation, precipitate formation, and this will lead to AKI, that is acute kidney injury, and this will result in ultimately the renal failure. So increased uric acid will lead to renal failure. Next, let us learn about increased phosphate level. What happens when phosphate levels are increased in your body? When phosphate levels are increased in your body, it will act as a chelating agent. this will act as a chelating agent. And this will, what does chelating agent means? Suppose this is your calcium. Calcium is moving freely, and here comes the phosphate, and phosphate is catching the calcium, so it is acting as the chelating agent. So this phosphate will act as a chelating agent, and it will decrease the calcium level, so it will lead to hypocalcemia. So you can understand how potassium level increase in your body, acting as a chelation or acting as chelating the calcium levels in your blood, and this leads to hypocalcemia. That means decrease in the amount of calcium in your blood. So what happens when you get the decrease in calcium level in your blood? What are the sensation you will get? When calcium decreases in your blood, you will get tingling sensation, you will get numbness, you will get muscle spasm. So all these things you will get, and you may also get seizure, you may also get spasm. So all these things you will get because of decreased calcium level. And why this decrease of calcium level has occurred? Because of increased phosphate level. As phosphate level has increased, this will act as a chelating agent, and it will chelate the calcium, and this will decrease the calcium in your blood, and this will cause tingling and numbness and muscle spasm and seizures. And the last one which I will be discussing is the hyperkalemia. That means increased potassium level. What happens when potassium level is increased in your blood? Basically, you get arrhythmias. And these arrhythmias are basically life-threatening arrhythmias. So always remember this. What are the conditions you are getting? So let me revise the three things. Hyperuricemia, when uric acid is increased, that leads to, when uric acid is increased, let me write it down for you. When uric acid is increased, that will lead to renal failure. And when potassium levels are increased, that will lead to decrease in calcium levels, and that will lead to tingling sensation, numbness. So tingling, numbness, all these things. And when you get potassium level increased in your blood, you get arrhythmias. So this is the summary. Now, how can we actually diagnose this? Basically, for diagnosis purpose, we use the Cairo and Bishop's criteria. So we have Cairo and Bishop, who actually told that we can diagnose it with two ways. One is lab diagnosis and by clinical diagnosis. So in lab diagnostics, we have three types. One is the uric acid. You can check the uric acid level, and you can check the potassium levels and phosphate levels. So potassium and phosphate both will be increased, and you can check also the calcium levels, which will be decreased. So these are the three types. And in clinical, you can have the symptoms of AKI, that is acute kidney injury, and also you can get arrhythmias, and also you can get seizure. So these three in clinical. So what is the management? Basically, for the management purpose, we use vigorous IV hydration, and this IV hydration is 3 liter per 24 hours. Number 2, which we use, is the allopurinol. You know, allopurinol is xanthine oxidase inhibitor. Xanthine oxidase. Now, do you know xanthine oxidase? Xanthine oxidase is the enzyme that is used for conversion of hypoxanthine to xanthine. Now, you remember that hypoxanthine to xanthine, and from that we convert to uric acid. So, we have xanthine oxidase as the enzyme for converting hypoxanthine to xanthine and then to uric acid. So when allopurinol it acts as a xanthine oxidase inhibitor. So uric acid will be decreased. In this way, it decreases the uric acid. And number 3, management is used in those patients which have high risk. So high risk patient, we use raspberry case. So raspberry case is actually the drug which is the urate oxidase. What does it means? It oxidizes the urate. So basically, what is the main function? The function of raspberry case is it converts the uric acid into more soluble allantoin. So what happens when uric acid is converted into more soluble item, allantoin? Basically, this can easily be excreted. And that is why we can use raspberry case in high risk patient, and raspberry case acts as the urate oxidase which will convert the uric acid to more soluble allantoin, and that can be easily excreted. So this is the end of this video. If you like this video, make a thumbs up and subscribe our channel. And if you are new to the channel, please visit our other videos of medicine, pathology, clinical anatomy, COVID-19, pharmacology and other things. You can all get all these videos in our playlist. You can check it out in our channel. Thank you so much. Have a nice day. Bye bye.